Welcome everyone to my program called Depression Hurts. Today we're going to go about learning about postpartum depression as opposed to the common baby blues, which are harmless and temporary. Major depression following a delivery of a newborn is serious. So all women should be aware of the complications and emotional trauma. First, it does not go away by itself. The signs range in intensity, including lack of interest in your baby, also resentful, negative feelings you may experience about the infant. They're likely and you'll worry about doing harm to your baby. You're likely to lose concern for yourself, harboring inner feelings of worthlessness. You'll be riddled with feelings of guilt, death, or suicide. These require immediate medical attention. You need to seek out competent help. The properly needed medication to correct those harmful thoughts is something you should entertain, as they recurrently attack your mind. Again, I emphasize, do not be confused, thinking you have just the baby blues. Normally, a mother will joyfully be positive over her blessed event. But if you have the symptoms I mentioned, which are grossly negative, that signals a red flag in your misguided thinking. Postpartum depression is thankfully rare. However, don't be fooled. It's extremely a serious illness. Listen to me, mothers, please. This is an illness that can and will develop into postpartum psychosis. It should be considered an emergency situation because of the high risk factor of suicide or even infanticide. The Creator doesn't want you to suffer with this disorder, caused by a chemical imbalance in the brain. The goodness of God can and will let you overcome this. I'm not intending to scare or alarm you people. That's not my intention. We counselors are trained to help, not hurt, to safeguard mother and baby. Usually a hospital stay is required with postpartum psychosis. So please don't be closed-minded to it. Also, people affected by this disease are seeing or hearing things that are not really there. Or irrational behavior, extreme agitation, extreme anxiety, or confusion accompany the inability to eat or sleep by the new mother. After childbirth, women have a major drop in hormonal levels, among with changes in their metabolism and blood pressure. The stress of caring for a newborn is in itself a big task. But you see, the children of depressed mothers are likely to develop behavior problems, which includes problem with sleep, agitation, temper tantrums, and outward aggression, along with hyperactivity. These innocent children do not make friends easily, and those they befriend have the same problem as they. Similar developmental problems, the risk of this is high. The child is at risk of major depression. We must emphasize to look on the bright side. realizing you can and will recover from postpartum depression. If you set your mind to getting medical, psychiatric aid, one-on-one, group therapy on a regular basis, often offered without charge, are essential for you. You can be an overcomer. Remember this. You will say, my soul is filled with joy and peace. Lying in the sunlight, my soul is filled with God's forgiveness. Letting go of past mistakes, never ceasing, I feel God's love for me. The sunlight lifts your mood. A good prescription is to daily get outside for short, soothing walks. Prayer is the hotline to God as He lovingly awaits to hear your call for help in all facets of your life. I've come to the close of today's session, and it's been my privilege to be able to share this symptoms with you of postpartum depression. May the good Lord bless and keep you and give you peace. God bless you.